It's a privilege and a pleasure to be sitting here with Taylor to talk a little bit about her most recent surgery. It's definitely a privilege because she's a person that I respect very much and I love. She is a friend for a long time, and also because many years ago I operated on Taylor's mother. So for me to have this level of trust and confidence from her whole family is one of the most gratifying gifts that I can ever have. So it's a pleasure, not only because we did a beautiful set of procedures for Taylor, but because he actually got to have a very unique and innovative procedure of mine, which is a mid-facelift, a facelift without really any incisions, any cuts in front and around the ear, just like the traditional facelifts are. Not everybody is a candidate for this type of facelift. The ideal candidate is somebody who is just beginning to see the beginning of jowls, which is the one thing that drives really everybody crazy. And once they see that, then they seek facial rejuvenation treatments because it simply alters the jawline. And there's nothing really that effectively fixes that but a type of a facelift. So in my procedure, I only do a very small incision here at the temple. It's hidden within the hair. When the hair grows, it's impossible really to see. And through that incision, I elevate the mid-face where it used to be at a more youthful age. That gives projection of the malar area. More simply put, it gives zygomatic projection, high cheekbones, which is an element of beauty. It improves the nasolabial folds and it corrects the jaws. It gives a nicer jawline and it gives a very nice and beautiful hollow just underneath the zygomatic prominence, which also is an element of beauty. So on top of that, in order to augment that lift, we added a little bit of fat, our own fat, to the cheek areas, and we added some fat to the lips as well. Did we add some fat anywhere else?
I think you fixed my this part here.
All right.
It was kind of crooked, so you adjusted it with fat. It looks amazing.
So and for that, that's the other part of that's the other beautiful part of this set of procedures, is that I had to do some liposuction to certain areas of her body to remove that fat in order to place it on the face. So we worked on some areas that are typically difficult areas for most people, like the inner and outer thighs and the flanks, to give her at the same time some nicer curves and better definition of the legs. So really, we did a lot, not just to your face, but to your whole body at the same time. But let me stop here and let you talk about all that. Okay. And how things have worked for you.
Sure, definitely. So I've known John for many years now, and I just love his work ethic and how detail-oriented it is, and he puts everything into what he's doing. So he's a perfectionist. And I definitely got that perfectionism in my body. Like, handed it over to him on an operating table. So I'm 39 right now, and I just noticed like all of this was like dropping down, and my lips were all shriveling up because of aging, and I was just like, oh God, it's getting really depressed because like you said, when this goes down, it's like, oh no, it's coming, the aging is coming, make it stop. And so I reached out to John, of course, and he has this amazing procedure. He says you don't have to get a full-on facelift, which it's pretty extensive surgery. And I just want to do something light. I've taken really good care of myself. So John has this innovative procedure where he said it's a very small cut on the sides here, and you'll have a permanent suspension bridge holding up your jowls. And I'm like, that sounds great. It sounds like the best preventative measure someone of my age could take to prevent everything drooping down because of aging, because of gravity. So basically he put a suspension bridge here, all the jowls are gone, and it just lifted up this vector right here. And you can't even tell, no one could tell I've had any work done unless I tell them I've had work done. Like they're like, oh, you look great, you know. But you know, it's a subtle thing when it starts going and it's your own face and you observe the changes to fix that. It's like a great woof. You know, I'm so glad that's not happening anymore.
That's a very nice description. Pardon the interruption, but now that I'm looking at you sideways,
yeah.
I'm also reminding myself that we actually added some fat here.
Yeah.
So I built your jawline and your chin forward, right? That's one of the things you wanted. So now your profile coming down from your nose is much more balanced.
Beautiful.
So a lot of little things that make a difference, you know, for the whole picture. So please continue.
Yeah, so definitely, I'm so grateful. So I'm like, John, do whatever you need to do to improve this body. I don't care what you got to do. You're the doctor. I completely trust you. You just go for it. So, like, I was just shocked in the most fantastical way of the results because my curves look just so much more beautiful. Like, you put these curves in me that are just like, it makes my chest like it look even more full, and my waist looks so just like a Barbie now. And then like the inner thighs, that you pull the fat out from my inner thighs and my flanks, and they just look so gorgeous. I just can't wait to lose weight and get the quarantine weight off of me, and then have that beautiful definition. And then what do you do with that fat? Well, you put it in my face and my chin, my lips. I had this weird, what do you call it when your septum is kind of like to the side?
Deviated septum.
Yeah, deviated septum. And it just didn't look good when I went like this. Like you could see this squiggly thing there. And you corrected it with fat and it looked amazing. It just balanced out my face. And the lips looked a lot fuller, so my lips were getting smaller. I think when you age, your lips get smaller. What happens there? What happens with your lips when you get older?
They do get smaller, you're right.
Yeah, they're getting like smaller, little shrivelly little lines, and I was like, that's not what I want it to look like. And then you just filled it up with my own fat, and I just love the fullness of it. It's beautiful. I love it, the work, and I feel confident that I have a permanent suspension bridge in my face, preventing it from dropping down any further than it has. So I'm really grateful, and it was very quick, very effective surgery. I woke up like smiling and happy, and the recovery was quick, and just
any pain?
No pain at all, like zero pain. So I felt like I was really well taken care of, and I loved the results, and no one could tell I had any work done. That's like the magic of it all. It's like, oh, you look fully natural, it just improved, just very subtle. So yeah, if you guys are scared of like, oh, I'm gonna look so different afterwards, like this doctor is your doctor, because it's so subtle.
Thank you for bringing that up.
Yeah.
Usually when it comes to work, plastic surgery, work on the face, people are more apprehensive, particularly when it comes to facelifting procedures.
Yeah.
So because you know you can't hide your face, it's your face.
Yeah.
So people tend to be apprehensive, but I'm glad you shared with us your feedback.
Yeah.
And it's great to see you. It's a good 6 months now after we did all this work. So basically what you see after 6 months is permanent.
Yeah.
Both for the facelift and the fat transfer. So I thank you.
Yeah, thank
and
you.
I'm very appreciative to you.
Yeah, I'm so grateful to know you and to be a part of your amazing capacity of transforming people's bodies and faces. It's beautiful. What a great gift.
Thank you for your
Yeah,
trust.
it's a great gift. You boost people's confidence. You make them feel better about themselves. You give them a new way of relating to the world by how they look. It's really important. It makes a huge difference. So thank you for that.
Thank you for sharing.
Yeah.